Part of our initiative in the foundation is partnering with local businesses. And we have partnered with Cummings Properties for many years.
We feel as though if we can foster relationships between our clients become more successful. And Beverly Hospital is one of those. Judy, we will be back. And since I've been in Beverly, I've come to understand that our interests are aligned more than I first suspected.
Steve has collaborated with Beverly Hospital and Addison Gilbert Hospital for many years. And ironically, this past winter, he found himself coming into our emergency department late at night in some great discomfort and was in the hospital for a few weeks.
I was having a difficult time breathing when I came in. It seemed as though there were 7 or 8 people whisking me into the emergency room in a matter of seconds. For a while, no one really knew exactly what this was, whether it was an infection or something more sinister. And that was quite an unnerving period of time. It wound up being a case of pneumonia that was encapsulated, I guess, in one part of my lung. Came to the conclusion about 10 days into this that nothing was working. The antibiotics were not getting into the infection. It wasn't clearing up. So it needed to be removed surgically. But in the end, I was cured and moving on with my life. There were a couple of things to me as a patient that stood out. The physical plant was, and I tend to look at those things when I walk into any building, even in someone's home. Sometimes my wife asked me if I could turn that off. But there was a point in time where I was inside for about 10 days, and I'm an outdoors person. I mean, I really like to be outside, and me being able to get out into that courtyard on a sunny day and walk around with my wife made a tremendous difference. I wouldn't have had that perspective if I wasn't a patient. If I was just looking at it from a pure corporate dollars and cents point of view, I would think that that wouldn't be that important, but it was. The main entrance to Beverly Hospital is something that it's nice. The wood floor makes a difference. I had a follow-up appointment with the Danvers facility. The Danvers facility is beautiful from the second you step in. The access, the nurses' station, give you a feeling as a patient that this is a place where I'm comfortable.
Many of our gifts come from corporate entities, but really what's behind that corporate entity is staff and workforce who believe in what the hospital is doing.
I have 100 people on my staff at Cummings Center, and about 80 people are tradespeople. And sometimes there's a cut finger or a hurt foot, and those people are whisked to Beverly Hospital and are there in a matter of minutes. That is part of the fabric of this community here, and that's important to us. McKay Street and Route 62. And my hope is that over time, our relationship with the hospital will become even stronger and more significant.